mechanical ventilator. The goals for using mechanical ventilator is to reverse hypoxemia, reverse acute respiratory acidosis, and relieve respiratory distress. It's not using to treat, but to support the respiratory function until the underlying cause is treated. This picture clarifies the mechanical ventilator device. On this machine there are different settings that should be presented on the mechanical ventilators that allow for delivering a specified amount of tidal volume, respiratory rate, O2 through a tube, and this tube is connected to endotracheal tube that is presented inside the trachea. There are different equipment used in the process of endotracheal intubation. Laryngoscope with a plate that used to visualize the larynx in order to have a good view for the insertion of endotracheal tube. Suction system, correct size for endotracheal tube, mainly 8 in adult, and stylet, which is a tube that used to stiffen the endotracheal tube, 10 ml syringe for cough inflation, McGill forceps for nasal intubation, pulse oximetry used to measure the O2 saturation, O2 source providing the oxygen, ambu bag, and tidal CO2 detector to detect the level of CO2 in the exhaled air, and also used to indicate the correct placement of endotracheal tube in the trachea, in which that the endotracheal tube is presented in the trachea, and there is no misplacement of the endotracheal tube either in the left or right main bronchus. Sedation and paralytic medication. The nursing action during intubation, we have to explain the procedure for the patient. The patient should be supine with a pack and with a small blanket under shoulder to hyperextend the neck in order to provide a good view and to open the airway well. 10 ml of air that is inserted to the cuff to ensure that this cuff is intact and working, functioning. Then the cuff is deflated before insertion طبعا. The stylet is thick wire used to stiffen the endotracheal tube for insertion. The end of the stylet must be kept 1 inch before the endotracheal tube to prevent tracheal perforation. إذا احنا بنمسك الاندوتراكيال تيوب وبندخل فيه الستايلت وبنخلي الستايلت هذه اللي هي عبارة عن وير 1 انش قبل مؤخرة الاندوتراكيال تيوب أو قبل نهاية الاندوتراكيال تيوب، ومن ثم ندخل الاندوتراكيال تيوب في الفم. تعمل هاي الستايلت على انه تخلي الاندوتراكيال تيوب قاسي، مش من السهل انه ينثني خلال عملية ادخاله في فم المريض. Point 6 confirms the suction is working properly before the procedure. Pre-oxygenate the patient using ambu bag. Administer sedation, paralytic agent to facilitate rapid intubation, and monitor O2 saturation. Regarding suction procedure, routine preparation like assembling equipment, suction, O2 system, and washing hand. Hyperoxygenate the patient with 100% of oxygen. Insert the catheter suction into the endotracheal tube without suction pressure applied، يعني خلال عملية إدخال الكاثيتر أو التيوب بتاع السكشن داخل الاندوتراكيال تيوب ما بنضغط على فوهة السكشن كاثيتر وما بنعمل بريشر، لأنه إحنا داخلين الآن ما بنشفط السوائل، بس ندخل الاندوتراكيال تيوب للمكان المناسب واحنا عمالنا بنسحب الكاثيتر من الاندوتراكيال تيوب. we have to apply a pressure and intermittent pressure provided من 80 ل 120 ملم mercury لمدة 10 ل 15 ثانية، وبعدين احنا بنسحب الكاثيتر اللي هو suction catheter. Do not instill sterile water only for thick solution. ومش دايما hyperoxygenate before and after each subsequent pass of the catheter for at least 30 seconds. طبعا باستخدام الأنبوباك، وهي الأنبوباك could be connected with O2 source. monitor heart rate and auto saturation، لأنه بعض المرضى بس نفكهم عن الاندوتريكري تيوب ونعمل suction مباشرة بصير respiratory distress والauto saturation بنزل والهارت ريت بتزيد. فإذا شفنا هاي العلامات مباشرة بنعمل reconnect للبيشنت to the endotracheal tube. وعملية السكشن بتكون as needed when there is a crackles, when there is a secretion in the airway. not scheduled، يعني مش مجدولة كل ساعتين كل ثلاث لازم نعمل، لا as needed. remove equipment, oral hygiene, wash hands for you, and then document the procedure. Document everything. The time of the procedure, if there are any complications that may encounter, any respiratory distress that may occur during the procedure, the procedure was done or performed successfully and the secretion was removed. The description for the secretions should be provided also. The advantage for endotracheal intubation keeps the airway patent, prevent any airway obstruction. Also, it permits suctioning of the airway secretion, remove of the secretion from the airway easily, especially for patients unable to cough. Enable delivery a high concentration of oxygen. It's a preferred method to provide a high concentration of oxygen, better than the nasal cannula or the face mask, because also we ensure that the accurate amount of oxygen delivered to the patient. In the past, they were using the mechanical ventilator or the endotracheal tube to deliver or to give a drug. Nowadays, we didn't use this route for administration of drugs. Facilitate delivery of selected tidal volume with the use of cuff that is deflated after insertion. We can prevent the aspiration so that we can decreasing the pulmonary colonization or any infection. Clinical assessment to confirm tube placement by inspection. While we are visualizing the chest expansion bilaterally، احنا بنطلع على الchest انه بعملية الانسبكشن في حال ادخال التايدال فوليوم انه بيرتفع chest bilaterally على الجهتين left و right chest بيرتفعوا symmetrically. Listen over the epigastrium. The breathing sound shouldn't be heard over the epigastrium and should be heard equally or should be heard on the lung. Listen over the lung field by stethoscope to hear the breathing sound using laryngoscope, and the most accurate method to indicate the correct placement of endotracheal tube is the end tidal CO2 detector. X-ray also may also help confirm the correct placement of endotracheal tube. يعني كل هاي النقاط نستخدمها حتى نتأكد إنه الانdotracheal tube في المكان الصح. Post intubation care: record the depth of the tube as marked at the front teeth and secure it من ثبته. Ongoing monitoring of endotracheal tube placement during transport and particularly when the patient is moved from one location to another. Obtain chest X-ray when visible to confirm the correct placement. The mechanical ventilator indications: it's mainly used in acute respiratory failure, evidenced by the lungs' inability to maintain arterial oxygenation or to eliminate the CO2. In the cases of sleep apnea, acute lung injury, blood gases showing persistent hypoxemia when the ABG's reading indicate that the PaCO2 more than 50 with pH less than 7.25, neurologic disease or neurologic loss of respiratory functions. All of these are indications for mechanical ventilator use. The complications of intubation problem: laryngoscope bronchospasm, hypoxemia, hypercapnia during intubation, which means decreased level of oxygen and increased level of CO2, bleeding related to trauma, fractured teeth, nosocomial infection, displacement of the tube either to the right main stem intubation, gastric intubation بدل ما ندخله في التراكيوم ندخله في الاسوفيجس, aspiration, tracheal stenosis, dysrhythmia, hypertension and hypotension. Mechanical ventilator does not treat respiratory failure, rather than it support oxygenation until appropriate treatment is applied. Usually indicated for life-threatening hypoxia, acute severe respiratory acidosis. Mechanical ventilator is usually determined based on the patient history and ABG's result. In a critical care setting, there are two types of breath that are provided for the patient using the mechanical ventilator. The spontaneous breath, which is initiated and ended by the patient, and the mandatory breath اللي هي الإجبارية initiated and ended by the ventilator. The classification for ventilator: negative pressure ventilator, which is the iron lung, exert a negative pressure on external chest, decreasing the intrathoracic pressure during inspiration, allow the air to flow from outside to inside the lung. This type do not require intubation, most used in pulmonary problem due to neuromuscular causes or diseases like myasthenia gravis. The most commonly used type of mechanical ventilator, which is the positive pressure ventilator, which inflates the lung by exerting positive pressure on the airway and thus force the alveoli to expand during inspiration. يجبر الحويصلات الهوائية على أنها تفتح خلال مرحلة الانspiration while the expiration occurs passively. Endotracheal intubation or tracheostomy is necessary here. And based on this type, there are 4 types of positive pressure ventilator: volume cycled, pressure cycled, flow cycled, and time cycled. The volume cycled ventilator, which is the most commonly used in a critical care setting, the inspiration terminated once a preset volume of air delivered, then allow passive expiration. إذا هذا النوع من الميكانيكال فنتليتر تنتهي السايكل فيه عندما يقوم بدفع كمية أو فوليوم معين من ال air to the patient. Pressure cycled ventilators: inspiration terminated once a preset pressure is reached, then allow passive expiration. هذا النوع تنتهي السايكل فيه عندما a preset pressure نصل إله. But this ventilator is not appropriate for patients who may not receive complete tidal volume if they have poor lung compliance and increased airway resistance. Flow cycled ventilator delivered a breath until a preset flow rate is achieved during inspiration, rarely used. Time cycled ventilator delivered a breath over a preset time period depending on inspiration and expiration ratio. إذا السايكل تنتهي عند إعطاء breath over a specified time. Mostly used in newborn and infants.